I'm going to be talking about pain management as a team sport today. So we heard this morning from Dr. Mackey about the Institute of Medicine report and the National Pain Strategy. And the takeaway message from both of those reports was that we need more integrated, interdisciplinary, patient-centered care. So I wanted to spend a little bit of time this morning sort of defining what that means. So think of interdisciplinary care as being a team approach. So that would mean that you would have multiple clinicians, including your pain physician, a pain psychologist, and also physical therapy. And to have an interdisciplinary team, you need to have them all located under the same roof, but also they need to be openly communicating with each other and with you. So multidisciplinary care would be if you had all of these providers, but they were working separately. They weren't communicating with each other about the treatment plan, or maybe you would just have a unimodal approach, which would be maybe you just have a physician or just a physical therapist. Now, the best evidence that we have for chronic back pain treatment is taking this interdisciplinary approach. So it's important that you have all of the clinicians talking, sharing the treatment plan, and then most importantly, as you'll see with the picture up top, that the circle with you, the patient in the middle, that's the largest. They need to be communicating the plan with you, okay? So on this treatment team, you're the MVP. You are the most valuable player on your team. Now, why is that? It's because the doctors can make recommendations, the physical therapist can give you strategies that you can use at home, pain psychology can help you, but really, you're the only one that can actually take these suggestions and put them into practice, right? I don't know of any doctor that can do that for you. I know I can't do it for you. So that really does make you the most valuable player on your team. Now, how many football fans do we have in the audience? All right. Those of you who don't know me, I am a diehard football fan. I love football. I wait all year for it to come back so my team can actually make it to the Super Bowl. They never do, but I'm waiting. So I wanted to use a football analogy to describe what an interdisciplinary approach might look like, or what it might not look like. So imagine that your medical doctor is your coach of your team. Okay? Pain psychology, we get to be the quarterback. Physical therapy is going to be the lineman, and you, the patient, you're the wide receiver. Now, for this football analogy regarding your back pain treatment, imagine that every touchdown scored means that you're living a full, valued, vital, functional life. So you want to score as many touchdowns as possible, right? Not just one, not just a fluke where you just accidentally score it, but you want repeated touchdowns scored. What do you think would happen if, you show up, it's game day, you're ready to play, you're ready to score those touchdowns, and all of a sudden you realize that the coach never shared the plan with you. You don't know what the play is. Probably decrease the chances of you actually scoring a touchdown, right? What would happen if you're out on the field and all of a sudden you look and you don't have a quarterback? It'd be harder to score, right? You really need, for this interdisciplinary team approach, you need everybody there, you need everybody showing up, you're ready to be the MVP, you're ready to play, but you need one more thing. You need everybody working from the same playbook. So what does that playbook look like for chronic back pain? It would be taking a biopsychosocial approach for treatment. So what does that mean? Well, Dr. Mackey talked a little bit about this morning. It means that you take into account all of the influences that affect how your brain processes pain. So we're taking in, factors like genetics, individual differences, gender. We're looking at mood and expectations, your thoughts about pain. And then we're taking into account, structural, your spine, your level of conditioning. All of these factors either turn up or turn down the volume of pain. So we really do need to look at all of them. And that's essentially what taking a biopsychosocial approach means. So what happens when you've got all your team members, everybody shows up to play, you're ready as the MVP, you're all working from the same playbook? Your outcomes are better. So what does that mean for you, the person who has pain? It means that you've got decreased pain severity. That's important. It means that you have less pain interference. So you can actually be more involved in life, your life, the things that matter to you. You're more likely to be able to do those things. You have improved function. But then we also see that your mood is better. Okay, Dr. Darnell just talked about the importance of mood. It's not everything, but it is one aspect of what can amplify your pain. So your mood is better, your sleep is better, and then ultimately what I think is most important, your quality of life. It's better. And I think, that's what people want. They want a high quality of life. You want to be able to do the things that matter to you. So I wanted to spend a little bit of time talking about the incredible team that I work with at the Stanford Pain Management Center. So we have our clinical pain faculty. Okay, that would include our physicians, our nurses, nurse practitioners, and also our physician assistant. You're going to be hearing more later on today regarding some of the medical aspects of the treatments that we provide in our center. Okay? And then one of the things that makes us unique at Stanford is that we have a pain medicine fellowship. So we're actually training new doctors to specialize in the treatment of chronic pain. So this goes back to what Dr. Mackey was talking about, the importance of educating providers on how to deliver pain management treatment. And then we have our pain psychology faculty, and that's part of what I do. We have numerous psychologists on staff, and we do both assessment, individual and group treatment. And we also have our pain psychology fellowship. I'm the primary supervisor for the fellowship, so I have an opportunity to train new psychologists on how to treat chronic pain. We have pain physical therapy. You're going to be hearing from two of our physical therapists later on today. And they also do assessment, individual, and group treatment. And then we have our complex case care managers. They help to coordinate needs. So if you're having a difficult time finding a treater in your community, they can help with the coordination of that. And then we have an MD acupuncturist, and then we have a strong connection with our research group. And you are going to be hearing more about research opportunities at the end of today's group. So with the Stanford team approach, we truly are doing interdisciplinary care. From proper prescriptions regarding chronic back pain, to different procedures that you may benefit from, to complementary and alternative approaches. So we make recommendations for over-the-counter supplements that can help with pain. We also have a nutritionist, dietitian that is in our clinic once a month, providing free therapy. And I'm going to talk a little bit about that in a second. And then we also have acupuncture, as I mentioned. So individual and group treatment, pain psychology, and physical therapy. And then we have something that's really cool. We have physical therapy and pain psychology teaching a group together, which is really fun. I teach that with Dr. Cooley, who's going to be up next. And then we have self-management. Now, for those of you who were here at Back Pain last year, I gave a talk on self-management. So I just wanted to take just a second to explain what self-management is, because what I've found is that people misperceive what this actually means. I've had patients say, well, does this mean I should just, suck it up and deal with it myself? I'm like, no, definitely that's not what we're saying. Self-management is you being the MVP of your treatment team. It means that you're taking all the recommendations and all the suggestions that are made to you, and you're putting them into practice. That's all self-management is. I mean, I would argue that you're all self-managers. Even people who maybe are really suffering and their pain has taken over their lives, they're still self-managing. They just need more tools to self-manage more effectively. So that brings us to our free programs. My mission at Stanford has been to implement as many programs as they will let me to help patients and their loved ones better understand and cope with pain. So in addition to the individual treatment and groups that I run and the supervision with our fellow, I also am in charge of our patient education and program development. So our first program is the Chronic Pain Self-Management Program. All of these are free. Did I mention that? They're all free. This is a 6-week group that if you've never been exposed to any pain psychology, if you haven't been exposed to pain psychology treatment before, this would be a great place to start because it teaches you the basics of pain management. And then each week, you're going to set goals for yourself. We call that action planning. And then when you come back to the group, if you ran into any trouble reaching your goals, which, let's be honest, we often do, then you do problem solving and brainstorming with your group. So this is a peer-led group. We also have the American Chronic Pain Association that's on site once a month. You'll notice when you registered this morning that there's a booth out there being manned by James Weil. He is the facilitator of the ACPA group that we have on site along with Sue Ellen Johnson. And these are people that have pain, and they are helping others learn how to better manage their pain and also helping you connect with resources. So the website is www.theacpa.org. Excellent information, so many resources for people who have pain and their loved ones. We also have the Pain Science Education and Family Support. Started that this year. I think this is such an exciting addition to our clinic because the Pain Science Education is a 30-minute lecture by one of our medical fellows, okay? And then it's followed by a family support group. So this group was really designed for loved ones and family members of our patients that have chronic back pain. I kept hearing from patients that, the people in my life, they don't understand why I still have pain. And they keep recommending, like, have you done yoga? Have you done acupuncture? When's your pain gonna go away? And it's frustrating. They mean well. Well, I'm gonna assume they mean well. But it's frustrating. So this group, patients are welcome to attend, but this group really is geared toward helping the people in your lives understand chronic pain and chronic pain treatments, and also how to support you and deal with some of the frustrations that maybe they have with some of your limitations. And then we have our pain psychology class. This is a single session cognitive behavioral class offered to help you better understand influences like catastrophizing and how that can amplify, or if you control it more effectively, turn down the volume on pain. And then we have our free nutritional class. So Heather Garza is going to be giving a talk later on today about nutrition and chronic pain, but we do have a monthly group that you can attend at our Stanford Center if you're interested. And that brings us to our clinical groups. So these are not free. We have our coping skills and our coping skills and movement group. Essentially, one has a movement component, one doesn't. It's a 9-week cognitive behavioral therapy group focused on learning how to more effectively use your brain to manage your pain. And then the 30-minute movement component is a very gentle, I guess yoga-like movements where you're moving through different ranges of motion at each joint and really building confidence on how your body moves, and we can modify any of the movements. Well, I don't do it. Our physical therapist does it. But so it really is appropriate for almost anyone. And then another group that I run in the clinic is our acceptance and commitment therapy group. I see some folks in the audience who've taken a couple of my groups. This is a really exciting new group that has started over the last year. And ACT is a little different from CBT. So CBT focuses on how can you, tools where you can control how you respond to pain. So looking at your thoughts under a microscope, restructuring them, changing them. ACT is a little different. ACT focuses on helping you identify what you're most passionate about in life. What matters to you? At the end of your life, what do you want your life to have, stood for? And then it teaches you how can you take your pain along with you. And in the beginning of the group, that seems almost impossible. Otherwise, why would you come spend, 8-9 weeks with me? The end of the group, I've had people tell me that this group is literally life-changing. I had a patient, we just finished up a group, I had a patient tell me that, I came to this group to learn how to better sleep. And at the end, it had completely transformed my relationship with pain, my relationship with my wife's response to my pain. I mean, that's just incredibly powerful. And then last is our movement and restoration group. So this is a group that's led by Corinne Cooley, our physical therapist, and it helps you to be able to get back to doing some of the activities that you once enjoyed. So even though it's a group setting, you have an individualized plan. She might talk more about that in a second. Okay. So I've talked a lot about our clinical groups, but as you know, we have a whole research arm that's doing just phenomenal work. And you're going to be hearing more about opportunities to participate in some of the research studies that are going on later today. So I wanted to just leave you with a question. How's your treatment team? Do you have all the players? Are they communicating with each other? Do you know what the game plan is? And do you feel like you're the MVP of your team? Thank you.